Ontario Chinese Health Coalition. I would like to warmly welcome all of you to our Vote for Health All Candidates meeting today. I'm Gloria Feng. 我是冯玉兰. I'm one of the two MCs today, and right beside me is Li Qing. So Li Qing, would you like to introduce yourself?
Sure. Hi everyone. My name is Li Qing Liu. I'm one of the co-chairs of the Ontario Chinese Health Coalition. Very welcome all of you to join us today.
The reason why we are organizing this all candidates meeting today is to provide an opportunity for all of you to better understand the various parties' platform and commitment on the health issue. And we would also like to provide a platform for all of you to understand what the commitment is, and so that you can make an informed decision on June 12th, the election day. And last but not least, we would also like to take this opportunity to encourage all of you, including your family members and friends, to cast your vote on June 12th to make sure that the party serving your best interests will be elected and that your voices will be heard.
So before we officially start, I want to make a note that the meeting will be conducted in English. However, we do have volunteers here today who do the translation. So if you want to have Cantonese translation, please, the Cantonese volunteer, please raise your hand so you can know for her for the translation if you need help. So you can ask questions later, also in the language that you are comfortable with. And we also have Mandarin translation support. Could you please raise your hand? So there she is. And we also have Korean translation.
오늘 이 모임에 오신 모든 분들께 이 모든 행사는 영어로 진행이 되고요. 한국 통역이 필요하신 분들은 우리 한국 분들 손 좀 들어주시겠어요? 저 자리로 가셔서 도움을 받으시면 되겠습니다.
Welcome. Last but not least, we have Vietnamese translation as well.
Nếu mà ở đây có ai cần không dịch lại bằng tiếng Việt thì xin tới ở bên này và bên kia cũng có người nói tiếng Việt.
Welcome everyone.
Now, before we start our candidates meeting today, I would like to invite Li Qing, the co-chair of our coalition, to introduce to you what this coalition is all about, and also the nature and also objective of the Vote for Health campaign.
Great. So Ontario Chinese Health Coalition is a group of 30 organizations have a shared vision to promote and improve the health of Chinese communities through collaboration and advocacy. So academic and government reports have recognized that immigrants' health declined very quickly after they came to Canada. Through our day-to-day work with immigrants, our member agencies also witness the challenges that immigrants are facing when it comes to health service. And therefore, in 2010, the agencies got together to fund this coalition in order to join our efforts to combat all these challenges. Nowadays, our member agencies, including health charities such as the Heart and Stroke Foundation, the Canadian Diabetes Association, the Kidney Foundation, and also mental health agencies such as the Hong Kong Mental Health Associations, health professional associations like the Canadian Chinese Medical Doctors Society and the Canadian Chinese Nurses Association. We have senior agencies joining us, including the Yi Hong Center for Geriatric Care and the Care First seniors and community services. We also have settlement agencies, which are very important in helping immigrants settling down, including the Center for Immigrants and Community Services and Toronto Cross-Cultural Service Association. And we also have other health partners like the community health centers as well. So during the 2011 election, the coalition carried out the Healthiest Province campaign in Chinese communities, calling provincial candidates to commit to increase investment in health promotion for immigrants. And in 2013, the coalition trained over 100 social workers and community health workers about health promotion and immigrant health in order to improve the quality of service. Last year, we started this community engagement campaign to train and mobilize our young volunteers to advocate for better health for immigrants. And that's why we are here today. Because since early May, when the election is called, these volunteers got together and feel very strongly that we should have an all-candidate meeting when we can have the opportunities to talk to our candidates from all parties about their platforms on health and health promotion and how they will improve the health of immigrants. So we are very pleased to see we got support from allies in the community like Civic Engagement Canada and our supporters and partners from the Korean and Vietnamese communities. We believe that through engagement and collaboration like this bring together partners, the public, and our decision makers, we will make Ontario a healthier place for immigrants.
So, without further ado, I would like to welcome our guests, that is the candidates representing various parties in different ridings to our candidates meeting. To the immediate right-hand side of Li Qing is Alex Wilson, the NDP candidate for Scarborough Agincourt. Let us give him a proper round of applause. And then next we have Teresa Pan, who is the candidate for Green Party in Willowdale. Next, we have Nadine Hopkins, the NDP candidate for Markham Unionville. And last but not least, we have Alan Small, the Libertarian Party's candidate for Markham Unionville as well. Actually, we still have one candidate who's going to arrive here at 3 p.m. That will be Shan Taraparan, representing PC in Markham Unionville. So by the time when he arrives, we are going to introduce him to all of you. So Li Qing, would you like to introduce the rules for our meeting today?
Sure. So today the meeting will be divided into two parts. So the first part, as organizers, we have 3 questions prepared for all the parties. So each party will have 2 minutes in total to answer each of the questions. Because we have 2 NDP candidates here today, so for the questions regarding party's platform, we have the rules that the 2 NDP candidates will share the 2 minutes in total. So they may choose to have one candidate to elaborate on their party's platform, or they could share the 2 minutes. Because we feel that it's very important to be fair to each party. So I think that's the rule. Oh, and be mindful of time. We are very strict with time, so please be prepared. Yeah, that's great. We have a representative from the coalition there, just on the first row. You can see she has the 10 number, so when you have 10 seconds left, she will signal you. And then, so please be prepared to wrap up your statements as soon as possible. And once you go over 2 minutes, we will stop you. We could be very mean.
Actually, we are not mean. We just want to be fair to everybody.
Okay, so let's start our first questions. So the first question is for each party. Can you tell us more about your party's platform on healthcare and health promotion? Why don't we, the first question, should we start from this side?
The first thing I'd like to say is thank you so much for coming. I'll use a second or two to say that. There's lots of different problems that we have within our healthcare system that the NDP is trying to address. So I think I'll speak for 1 minute and then Nadine can have the other minute. So the first thing is that we need to invest into our hospitals, especially in the Scarborough area. There has been $0 going into the infrastructure. Meanwhile, all these various other hospitals get millions and millions of dollars. Humber River gets $1.75 billion. We want money into Scarborough hospitals. We also want to make sure that people are not waiting a long time in the emergency room. So we will introduce 50 24-hour health clinics, and we'll add 2 nurses to every single emergency room in the province of Ontario. So those are some of the priorities, and I'm sure that my colleague from the NDP, Nadine, will have some other words. Thank you.
Thank you, Alex.
The NDP found that 17% of Ontario hospital beds were occupied by patients that needed home care. And this led to an expensive backup of the emergency rooms. So as Alex said, we're going to build 50 24-hour family health clinics. We're going to use nurse practitioners to treat and discharge emergency room patients and provide a $1,275 caregiver tax credit to family members who are supportive. We would also forgive deaths of doctors willing to work in underserviced communities and eliminate the wait list for long-term care. Because the NDP understand the determinants of health, including mental health, we've worked hard to expand social assistance and affordable housing. We're also committed to raising the minimum wage to $12, enabling environmental assessments to prevent toxins, and to working with communities to expand bike paths. We would ensure students are provided with the range of programs, supports, and resources they need to achieve success in school. Given the prevalence of diabetes, heart attack, and stroke due to childhood obesity, we would include mandatory physical education and proper nutrition in school.
Thank you. Thank you. And now is the Teresa from Green Party. Thank you.
Hi everyone. 我係一個醫生and I work at Yonge and Eglinton and Richmond Hill. 對唔住，我哋廣東話講真係少少嘅。不過 with the Green Party, one thing we want to do is increase the number of long-term care beds. 我係個醫生嘅好多人，我見喺個醫院，佢哋係冇唔得返屋企，同埋一定佢哋等喺個醫院，因為冇地方俾佢哋去。A lot of old people are lingering in the hospital because they don't have a place to go. A lot of them cannot go home safely with home care, and we need to increase the number of long-term care beds now before our elderly population continues to increase. That is one of the many things that the Green Party pledges to do. Thank you.
And then next is Alan from Libertarian Party.
Thank you. Ontario Libertarians believe that healthcare should be the responsibility of individuals and their families in consultation with their chosen physicians. People in need of medical care should have as many options as possible for diagnostics and treatment. To make medical care more affordable, sustainable, and accessible, competition and innovation must be introduced at every level. To To do this, government must be removed from the equation as much as possible. We believe in a free market in healthcare. We have three ways to alter the current situation. First, we believe that the funding model for OHIP must be changed for hospitals. Second, we think that a nominal co-payment should be added to all medical visits. And third, we would like to legalize private alternatives so that people may have an option to go to either a public hospital or a private medical clinic to get care. Thank you.
Thank you very much.
So I'm going to ask the question representing the organizer. Based on reports and frontline experiences of our member organizations, language and cultural barriers are the biggest challenges to immigrants when it comes to health services. So, when you are elected, what will be your plan to make it easier for immigrants who speak English as a second language to get equitable access to health services? So, shall we start with Alan Small this time?
Well, I believe that the community is the response. It is the best place for people to get medical care. The Chinese community has been here for a very long time, since the founding of this nation, and I know that there are many parts of the community that have organized themselves in such a way that they can facilitate access for new immigrants to physicians, medical services. The problem is we have a top-down situation. Right now, the provincial government and the federal government impose a situation on top of the community, which makes it difficult for individuals in the community to access care. We think communities need to be built from the ground up, from the roots. And the Chinese community, the East Asian community has a long history in this country, and they are the ones that know best how to give their people good access to medical care. And the problem that I've already stated is that we have a top-down situation. So if there were private options, if there were other options other than the system that exists today, we think that that would be most beneficial to new recent immigrants for their health care.
Thank you, Alan. So shall we have Nadine to be the next one to answer the question, and followed by Alex, because they both belong to NDP.
In 2010, the Government of Canada cut funding to immigrant settlement services in Ontario by almost $44 million. The Liberals failed to step in to restore those services, but Andrea Horwath feels that newcomers must have better access to settlement services and accreditation programs. The NDP want to make it easier for immigrants to work in their professions and live free of discrimination and get health care. In addition, there's currently a case before the court, as you probably know, to allow people to speak to their patients in Chinese, and that would come under the Regulated Health Professional Practice College, and the province would encourage this new association to seek new ways of addressing Chinese patients, to look to the population's needs and provide for them in Chinese.
Thank you, Nadine. Wilson? Oh, Alex, do you have anything to supplement?
just got married there. I didn't even know that. I think it's so important to come out to events like this where we can engage in people and listen. And I know that as I've gone around Scarborough Aging Court, that language is so critical. I always go around with someone who either speak Cantonese or Mandarin or Tamil so that we can connect with people. And these are such important language services that we need to have in all of our institutions, in our hospitals, in our schools, and even in dealing with home care. And so we want to try to match people linguistically in terms of home care services, as well as making sure there's adequate interpretation services within the hospital. Thank you.
Thank you, Alice. So next, we will have Teresa.
Hi，喺個醫院，我係讀醫科喺 University of Toronto，同埋喺嗰啲醫院，如果你要一個人講中文或廣東話或國語，佢哋會揾一個人可以幫你。So as a medical student, I often translated for people in different departments because you would hear a PA call, and that's what we would do. That works in the hospital, but for many immigrants, that is the last place we want you to get care. We need everyone to have a family doctor. 同埋我哋應該揾一個佢個家庭醫生又可以講中文，咁可以幫你啲人啱啱嚟到加拿大，可以幫你唔會有病啊，可以幫你教你點樣食藥㗎。同埋 the last thing we want is for you to get more sick, which is what is shown in the past. We need more interpreters, and we need to connect people with family doctors when they land. Thank you.
Great. So the last question is from organizers. It's about an immigrant-specific health strategy. So in order to make Ontario a healthier place for all, new or old immigrants or Canadian-born, we believe that Ontario needs an immigrant-specific health strategy to improve immigrants' health and health service. So will your party support this idea? And if so, what resources will be required to implement this plan? And who will be the stakeholders to engage? And this time I think we will start from Teresa.
The federal government did cut a lot of funding to immigrant health, and that was something that we as doctors lobbied against and very strongly against. It is time that Ontario has their own strategy. 而家喺加拿大，好多人係移民嚟加拿大，佢哋唔得嗰啲藥，你要自己俾錢。好多嗰啲人好陰功嘅，啱啱嚟加拿大，乜嘢都冇，乜嘢工作都冇。你點樣可以叫佢俾錢佢自己嗰啲藥？佢唔食嗰啲藥，佢哋去邊度？佢哋去到醫院。So once they cut funding for things like drugs, for example, refugees and other immigrants, what happens? I've seen lupus patients get so sick that they have to come to the hospital. So I think we cannot wait for Canada itself to work on this. We need Ontario to be behind this. I would definitely support a strategy for immigrant health, and I believe that the Ontario government should take the lead on this and not wait for the federal government. Thank you.
And then I think this time will be Alan, go the second. Yep.
Well, I think you'll see the difference between myself and the other people at this table. They will advocate for you a centrally planned solution to everything. And I think it's important to understand that the idea of central planning in government doesn't work. It's been proven. Just give you an example. The Soviet Union collapsed after 72 years of central planning. We're having issues here because of government central planning. We don't think that a centrally planned solution is the answer for a community like this one, like the East Asian and Chinese community here in Markham Unionville or Scarborough Aging Court or any of the various communities around here. We think the only solution is a community organized solution. The community knows best what it can do for the people. It knows best what the needs of the people are. We think that funding should remain with OHIP, but I also believe that there should be a private option for people to go to, and that will make it much easier to access, including, I think, various East Asian and Chinese medical practices that right now aren't even allowed here, and I'm talking about various types of Chinese medicine, which may or may not work, but I believe that that it's very important that people be allowed to access what is familiar to them, and I think the community approach is the best approach.
Okay, and our NDP candidates.
I have to disagree. I think our healthcare system is the best thing in the world, and we've proven that public healthcare is cheaper than private healthcare. We're taking care of all the people. People come to Canada for our healthcare system. The U.S. is following our example, and the answer is to communicate with different communities, to provide special services that this community needs. You obviously need language services. We would give you language services, and you would be the person who tells us what you want. It would be a bottom-up communication.
I'd like to add to that. It is very important that we go to all the different community organizations and listen to them, because we need to hear the first-hand stories of newcomers and to find out exactly what the barriers are that they face. We need to speak to experts in the field, people who work in immigration, people who are immigration lawyers, and gather that information so that the service that we provide will be meaningful, whether it's in Mandarin or Cantonese or in Tamil. We need to have very specific services that are for people when they come here so that they can feel comfortable, because if you don't have that linguistic connection, it's very hard to feel comfortable and to get the healthcare that you need. I also want to remind everyone here that it is because of the NDP and Tommy Douglas, who is a Baptist preacher, I'm a preacher myself too, Presbyterian, who started the whole healthcare program that we have today. He also gave us the CPP. So we in the NDP support the healthcare system, and especially making it unified and applying to all the groups that come to Canada. Thank you.